A typical day at work, returned from lunch with some coworkers, and had just celebrated the wedding of my oldest son the Saturday before. So we had spent our lunch break looking at pictures, laughing at videos, just having a good time. Felt great. Walked back into the office. Within just a few moments of returning, I felt this horrible pain in the center of my chest. And immediately, as a woman, I thought, gosh, what I ate for lunch hasn't settled with me. But it didn't take me but just a few moments to realize this is more than indigestion. It felt as though someone came from behind and was squeezing my chest with a rubber band. Once I realized that it was probably not indigestion, my nursing skills went into play, and I went immediately to try to find some aspirin. And so I walked back to Dr. Brady's nurse's station where he was standing, and I opened the cabinet, and he asked, "What are you doing?" And I said, "I need aspirin." And I guess he could tell on my face something wasn't just right. So he asked, "What's wrong with you?" And as I clutched my chest and sat down in the chair, I told him, I'm having significant chest pain. And immediately I was placed in the exam room. He ordered the EKG, and just a few moments later he interpreted the EKG, and he came back in the room and he said, "Jan, you're having a heart attack." And my first intuition was, no, not me. Maybe her, but not me. I'm 49 years old. That's not supposed to happen, but it did.
Well, I had walked out of my office towards the nurse's station, and when I looked at Jan, she did not look well. She was holding her chest. I thought she was probably having a heart attack. I told Leanne to call 911. We got her in the room, did an EKG, and then I told my nurse April to start an IV. I then sent out a group text message to Dr. Staten and Dr. Luke. Dr. Staten happened to be in the cath lab, so he went ahead and had them get another cath suite ready so that, they would be ready when Jan got to the hospital.
So I arrive at the emergency room, and Dr. Staten opens the door to the ambulance, he and a trauma nurse, and we were directed or chaperoned directly to the cath lab by Dr. Staten and the nurse. And there it was chaos, a perfect chaos though, I should say. Everybody giving orders and just working with me to get me on the table and prepped as quickly as possible. So from the time I arrived at the emergency room until the blockage was cleared and my heart perfused appropriately was 18 minutes. Once the first cath procedure was over, I was taken up to cardiac ICU where I spent 4 days. The nursing staff there was great. Interacting with Dr. Staten was great. Anytime I had a need, he was always there to take care of it. The continuity of care was wonderful. I was lucky. I had the same nurses for day shift and night shift, so they knew exactly where I was with my healing process at all times.